Ambulatory emergency care is an emerging new way of managing acutely ill patients in hospitals. Patients who traditionally would have been admitted for investigation and management can now attend an ambulatory care unit where they have early assessment, early rapid consultant-led senior review, and that very day diagnostics, which allow institution of an immediate management plan and discharge on the same day. Ambulatory care is suitable for a number of patients. The benefits to the older patients that are now presenting to hospitals are that we avoid inpatient admission. We know that elderly patients decondition when they're in a hospital bed, and we'd like to avoid this at all costs. And if we can manage these patients in an ambulatory care unit, it helps outcomes in terms of maintaining people's well-being. In addition to this, a number of traditional pathways such as DVTs, non-cardiac chest pains such as pulmonary emboli, have also been managed now in an ambulatory care setting. People are also starting to use the ambulatory care unit for interventions such as once daily antibiotics, infusions of furosemide for heart failure patients, and the list of conditions that people are trying to manage in this way is constantly increasing. The toolkit outlines various models of ambulatory emergency care. There's the passive model, which allows for patients to be just referred to the ambulatory care unit from either the ED or from primary care. There's the pull model, where staff from the ambulatory care unit actually walk the floor on the ED department and identify patients and actively pull them into the ambulatory care setting and look after them there. There's also the pathway model, where certain clinical conditions in a defined context can be managed and directly fed through the ambulatory care unit. But the ideal way is the integrated way, where it becomes part of the process, where ambulatory care is seen as a day-to-day regular option for certain conditions and certain patients to be managed in not an ED setting. To develop and support an ambulatory emergency care unit, you need a number of core factors. The first thing is an enthusiastic team with communication between all partners in the hospital and collaboration on specialties and with the ED department, diagnostics, and various members that would be involved in trying to manage the patient holistically. Patient information, early patient communication is also extremely important in setting the agenda for that day care and discharge. In addition to the team structure and the communication and collaboration, the geography of the ambulatory care unit is also quite important. It needs to be central. It needs to be very close to the acute medical unit and the emergency department for it to function robustly and swiftly. The benefits of ambulatory care, first and foremost, are for the patient. The patient satisfaction that's been reported from a number of centres that have undertaken ambulatory care has been tremendous. This comes from the fact that patients do not necessarily want to be in hospital to be looked after and would rather be in the comfort of their own homes, having the care that they need delivered on that day. This also helps carers and support workers because in this current climate, the amount that we are having to do for the elderly patients is increasing, and this way of working is imperative to our sustenance in the future. Ambulatory care actually at an individual level does provide a super added benefit. I take the example of a young woman who had just delivered a baby. Pregnancy being a high-risk condition for pulmonary embolus, she presented with chest pain, which was very likely to be a pulmonary embolus. She was managed in the ambulatory care unit, and the decision and confirmed PE was made, and she was treated in an ambulatory care setting. She was overjoyed that she didn't have to be admitted because she didn't want to be parted from her 4-day-old baby. And this is the sort of advantage that we give by managing people in this way. NHS trusts themselves will benefit from ambulatory emergency care. The trusts that have started to implement this are already seeing nearly 30% of their acute take being managed through ambulatory care. In addition to this, ambulatory care takes significant pressure off the ED departments, which are very, very busy. Ambulatory care also avoids unnecessary admissions, which means better utilization of resource and better care all around.